Hi, I'm Dr. Jeff Rohde. We're here at my practice in Santa Barbara, California. We're a general practice office, but we do all kinds of stuff. We do dentures, we do cosmetic dentistry, we like to work on kids, we do dental implants here, so a lot of procedures that we do, including restorative dentistry. One of the things we're used to is when we place a composite, say on a posterior tooth, is going by small 2mm increments to make sure we don't have any shrinkage of the material. Today we're looking at an innovative product from Kerr that allows us to place the entire filling as a bulk fill filling all at the same time. So here we are in our operatory. We have our intro kit here. We're going to try out SonicFill for the first time here. So the intro kit has a couple neat things. There's actually a DVD in here that will give you technique guides and directions. I mean, it's great to see this on video, obviously, first before we got started, but we're going to just jump in right there. Obviously, it comes with the actual SonicFill handpiece, a nice little case here, and here's the handpiece itself. It does connect with the multiflex coupler. Obviously, Cavo makes the multiflex coupler, but you can have a lot of other manufacturers if you already have one. They're pretty easy to find now. The kit also comes with a couple practice teeth to start with, although we're going to use our little Type It on here. And then a lot of composites, so you can really get started not just on the practice teeth, but go ahead and start using it on the patients too, once you get a good feel for it. But there's definitely enough here to really get you comfortable with using this product from the get-go. The other thing that we have is a quick start guide from Kerr that kind of, out of just a few little bullet points here, really shows us how easy it is to use and how easy it is to hook it up. So we're going to go ahead and attach the handpiece to the multiflex coupler. It goes on really easily. One of the things I could see right away is that the tip is really small. This lets me know that even for the smallest cavity preparations where I'm trying to be really conservative with the amount of tooth structure removing, also cases with pediatric patients, the tip's nice enough that it can really get in there even down to the deepest class 2 there. So I like the size of that already. So I'm going to go ahead and attach our tip to the handpiece by screwing the handpiece onto the tip and make sure that's nice and snug in there. And when you go to put this into the cavity preparation, make sure you put it all the way down to the bottom. The action is going to be one as if you're backfilling this cavity preparation and letting the material push out. So we'll go ahead and hit our pedal. So the handling of the material is very nice. This kind of allows me to, I got a little extra there. The material is really sculptable, just like the universal composite you're used to. So I can get this all adapted into the preparation there. And the nice thing is it's really adapting well and sticking to the edges of the margins of the cavity preparation as well. So, all right, we're ready to cure. And I got nice tight margin there. You can see where we're going to have a little bit of polishing to do, and obviously bite adjustment. We want to check your occlusion just like you normally would and follow up with a minimal polishing here, but otherwise most of our work's done. We're just a few seconds in. One of the things I want to see not only is good adaptation, but I want to make sure that it not only did it form well to the walls, but that it's actually cured all the way through. And so popping it right out right after the initial curing, we haven't done any additional curing, and I'm at the bottom here and I can actually feel that gingival floor is totally hard, totally solid. The handling of this now, it goes to a really viscous state. Kerr says that you get 87% drop in viscosity. Not that you would load any other composite in here, but if you loaded any other composite into the system, you would only get maybe a 30% change in viscosity. So really we're getting the characteristics of a flowable composite, so you get good adaptation all the way down into the cavity preparation. Now that the power is turned off though, the way this handles is just like any other universal composite. It feels good, it's adapting well to the walls, and it's compressing really nicely. All right, so we're going to do our core buildup on this tooth that's missing the lingual cusp here. We'll go ahead and start here. So the material is dispensed in there without any voids, nice adaptation to the walls there. One of the things we're noticing right away about this is that it goes out fluidly, but it's not runny. I'm able to still sculpt this very nicely and do a buildup and stack it on itself without it running into the corners or running into the interproximal or all over the pallet. This is going to then create a nice dense core without any voids for my crown preparation. So let's go ahead and cure this. I just popped out of the preparation there. You know, immediately I can see that we have really good adaptation along the gingival floor and the pulpal floor of the core buildup here. So there's no voids or anything. The other thing is what I'm looking for really is some goopy, uncured composite. I just don't see it. I mean, we're 4 millimeters deep here, and I'm getting curing all the way through, and I did the entire thing at one time. So good adaptation, and a lot of the Kerr studies showing that we're not really getting shrinkage away from the margins as well. So pretty fantastic. One of the things to keep in mind, your PSI has to be turned up probably a little bit more than you used to, 35 to 60 PSI. It's not going to dispense fast enough if you have it below that, so make sure you're checking that on your delivery system, whatever kind you have. You know, this is really neat to get hands on. I really feel like I have a feel for what we're seeing here. Probably what we'll do next is take a look at the technique video. There's a couple clinical cases on here that I'd really like to see. We'll take a look, and I'm sure we'll get a lot of our questions answered there too. The other thing I think Kerr has done really well here is give you a couple different configurations. So depending on how your office is set up or how many hand pieces you end up getting, if you want to have other doctors in your office try it out, they've really kind of put these together in a nice way to get you started. And then after that, you can order anything piece by piece to keep moving along there. To believe it, you really have to see it, I think. If you want to schedule your own demo in your own office to get your own hands on the material and really to see the unique characteristics of this restorative material, you can go on Kerr website, they can schedule a demo there, you can contact your local rep, but lots of opportunities for you to really get this in your practice and to try it out yourself. Check it out.